It's important that we not just educate patients about what services are available from pharmacists, but we show them. We show them the value, and the only way to do it is to start with the patient and provide the education, provide them that individual care. And then once they see that value, they will continue to come back for follow-up by the pharmacist.
Patients, they love it. They're thrilled with it. The feedback, so anytime we end a follow-up consultation, I always tell the patients that, we've touched on 4 out of the 10 things that I want to talk to you about. This is not a mandatory thing that you come back. I'm going to leave it up to you to come back to follow up with me. I would suggest a month you come back and we'll talk about, this time we'll talk about, foot care and eye care, and maybe we'll touch on your insulin again. And I leave it to the patient to call us back, and we have found that a majority of the patients are now calling us back for a follow-up appointment because they see the value in the follow-up.
Some of the advice I would give to community pharmacies if they're trying to think about how to improve follow-up in their pharmacy or how to incorporate quality improvement would be to really think about the small group of people that they'd want to work with first. So try not to go too big. A group of people that might be even 20, 30 people in a smaller group to say, how can I work with these people over the next month, over the next few months, and then build up from there so that it doesn't become so overwhelming.
I've been asked the question, does this research still matter? Because we know the current provincial government has just recently announced that meds check diabetes will be phased out. There'll be a new type of meds check focusing on transitions of care. And my answer is that it matters now more than ever, because meds check diabetes, the intent was very good. Help people with diabetes understand their medications, why they're taking them, and to improve adherence and their understanding. So it's an important program, it's a good program for people with diabetes. Why didn't it work? Why is it being phased out? And I think our research has uncovered a lot of things that can help inform a future meds check program. Even if the future med check program is only focused on transitions of care, so patients transitioning from hospital back to community, we know from our research in meds check diabetes that over 1/3 of the people that received a meds check diabetes had a hospitalization or ER visit due to diabetes in the year prior to their meds check assessment. So even if the new program is not specific to diabetes, people with diabetes should be involved and should receive that care, because we know that people with diabetes go to hospital and they go to ER and they go to multiple different specialists and clinics, and we need to provide that continuity of care.
I'm glad that I participated in this project because I find that pharmacies and pharmacists are often very busy. So we do a lot of problem solving and talking to the patient and helping the patients understand their condition. We do a lot of these things for free. And we do a lot of these things without officially documenting it, because we felt that that is just the right thing to do. We do it because we consider that as part of our jobs. And with this project, I find that we were able to talk among the staff, just identifying things that we already do, but how do we do it in a way that we can document it so that other people can see what we do, and that the patient's reaction and their feedback, that we are able to document, and so that we all understand, this is the value of our work. I think the patients do appreciate our work, and that is why they come back, to the pharmacy. But sometimes even as staff, as pharmacy staff, they don't even know their own value sometimes. They do a lot of these work, and they might not know, what we do on our own time, because pharmacists often work in different shifts. So, to have this project where we can kind of group together and see what we're all doing. I think that was valuable even for the staff to see.
For those patients that kind of saw the merit of our interviews, they took away something from our interviews and learned more about their medication or a condition. And I think that both empowers the patient since they know more about their health and they can control it more. And it also empowers the team because they know that we've made a difference in that patient's life.
We got all the physicians on board, and now we've started doing, the diabetes med checks and the follow-ups. And we're also now calling the patients back after the follow-up to see what they thought of it and was it valuable. So we continue to do that, and we're hoping to roll this out to the 4th store soon, and then we're just going to continue to expand the patients that we identify for follow-ups.
I think we've learned that it's doable, and that having quality improvement techniques and processes in community pharmacy is doable, feasible, that it's exciting for the pharmacists who are involved, that they really are invigorated by thinking about providing care using these systems in place, that they get confidence in how their own care processes are improving and what they can do for the patients in their environment. So I think we're gratified to know that actually it can work. It does take some work, but overall our takeaway is that it can work, and people can improve not only follow-up for people with diabetes, but also just the overall care environment in where they practice.